Already, welcome to the
I'm ready.
AOECS third awareness raising webinar. Today we are going to dive in with possible connections between celiac disease and mental health. Mental health is the foundation of human beings to thrive, cope with the life challenges, and also contribute to their skills, passion, and souls to a better society. Celiac disease elevate rate of infradiagnosis. For example, in Europe, it can take between 7 to 10 years before the patient is properly diagnosed as having celiac disease, can represent an important level of stress and discomfort for severe impact in mental health. But that is just an example. To learn more about the connections between celiac disease and mental health and how we can become more resilient, I have the pleasure to count to a standing panel of experts today that will walk us through the topic. So I would warmly like to welcome Ronya Sritan and Ricardo Fuello. Welcome.
Hi, thank you very much for the invitation.
Hello, it's a pleasure to be here.
Thank you. So they are both psychologists, and you also have particular interest in celiac disease. You will tell us later, and I extremely honored to have you, both of you. But before I give you the floor, maybe just few words on who we are, what celiac disease is about, and also a big thank to Takeda and Dr. Falk for having supported this series of webinars. So AOECS is a non-profit umbrella association of national celiac societies, healthcare organizations, and other non-profit organizations that work together to improve the life of people affected by celiac disease. Our mission is to unite, support, and create synergies among our members to raise awareness and advocate for celiac disease rights, both at the European level and also international level, like the Codex Alimentarius. Share best practice and empower our members for better patient advocacy at the national level, and also to manage and enhance the European licensing system that helps celiac patients easily recognize gluten-free foods that are suitable for them. For those that do not know, celiac disease is a chronic, multi-organ, autoimmune disease that affects genetically predisposed individuals. The incidence of celiac disease is estimated around 1.2% of the population, although, as I mentioned at the beginning, there is a great level of people that is not yet being diagnosed. Traditionally, celiac disease has been associated to a gastroenterologist disorder, which potentially explains the lack of awareness among other healthcare professionals on this multi-organ nature of the celiac disease. But without further delay, I want to welcome Ronya and also welcome Ricardo, and thank you again for being here to share your expertise on celiac disease and mental health. So my first question will be for Ricardo. Thank you, Ricardo. So what could you tell us about what science is telling us today, or what scientific knowledge do we have about connections between celiac disease and mental health?
Well, thank you. Good afternoon, everybody. Um, uh, as I've been presented, I'm a psychologist and I'm a researcher on celiac disease. And although I'm not celiac myself, I'm affected because my children and my wife are celiac. So most of what I'm going to tell today, this afternoon, is about research and also about my experience. Okay, so uh, as you have said, Veronica, the only treatment for celiac disease is a strict gluten-free diet for lifelong. So let me break down this sentence into pieces. The only treatment, so there's no other treatment for celiac disease than that gluten-free diet. It's got to be a strict and it's gonna be lifelong. So when you are diagnosed, when one is diagnosed of celiac disease, it's a big challenge what needs to face, and uh, and there's no treatment but following a strict gluten-free diet for life. So what the research says right now about mental health is that the most important pathologies associated to celiac disease is stress and anxiety and depression. Stress because you got to be very strict. You got to plan in advance every meal, and you need to have 5 meals a day. So it's a treatment that you got to control strictly during the whole day. And you got to face situations like unwanted visibility, being left out in parties and in meetings. Probably you haven't been taken into account when you need to, when you are ready to have lunch, for example. So it is stress, anxiety, and depression, those pathologies most associated to celiac disease. But if you develop and adhere adequately to a gluten-free diet, you are probably going to have a mental normal life.
Okay.
A normal mental life. Okay.
Thank you, Kat.
Thank you.
Can I add something
Yeah,
to this
absolutely.
question?
I wanted to ask you. Yeah, Ronya.
Very good. Yeah, I want maybe it's also important to know what I do as work, because I'm a psychologist, but I'm specialized on nutrition psychology and health psychology. So I work in education, but also I have my patients one-to-one in my how you say praxis, yeah, in the counseling situation. Yeah, and I work also as a co-president from the Swiss Society of Celiac. And I'm celiac by myself, and I'm affected also in family genetic situations. So exactly. Yeah, thank you, Ricardo, for answering or starting with the answer for the first part. I think it's very important to add a few things from the research perspective about the field of the research about celiac, because my problem often is that the field of the research about health or mental health, I want to focus on mental health, in the celiac science or the science around celiac disease is very rare. So there is not a lot of strong research. There is not a lot of we do not have a big source of search papers. So that's a big problem about celiac disease in general. So our the science problem around it. But what's the interesting part is also to make the research around the chronic disease around gastroenterological chronic disease, which are inflammatory. So we could compare some data with the celiac outcome. So it's not, if we search in data, we do not search just on the focus celiac, we also can compare some chronic inflammatory diseases, for example, Crohn colitis or morbus Crohn, which is, for example, the nutrition behavior, or also how you cope with the diagnosis, and everything could be very similar and very also comparable. But the big difference, Ricardo also already said, that after the diagnosis, that's a big difference to other inflammatory diseases. The thing is that if we eat gluten-free, we are actually healthy. But the thing is, and that's a big issue, that there are also we have to look like the gut-brain connection. So we one part is the psychological part, which comes out after the diagnosis. For example, that's what Ricardo already said about the problems, the social life, the organization of the food, also the costs, for example, could also be a big stressor. That the whole economical part around the disease is not easy, and all the flexibility and everything. So those are the psychological stressors in the all-day life organization. But there are also other parts where we have to be aware on. And one part is that what Ricardo already said about the anxiety and depression, the amount that we have a higher visibility or a higher amount. Sorry, I try to speak in English. I give my best, but we have a higher rate on anxiety and depression numbers from celiac disease, from celiacs. But the explanation around it's not very easy. It's not just the outcome of the diagnosis. It could be also the part before the diagnosis, the whole part where the brain, the gut-brain connection, where the hormones are produced also by microbiome and all those things, that we could also talk about malabsorption. For example, the whole time where you have a lack of diagnosis, you don't know what happens to your body. And also the whole, there are a lot of processes where we are psychologically involved. For example, you are aware that your body is not working well. You are over aware maybe, or you do not have an explanation. You search for a long time. Veronica, you already said it's around 5 to 10 years, whereas the way that nobody believes you, something is wrong, you are just looking for explanations. And all this time, you could also have a lack of vitamins, of nutrition, Nährstoffe, which is very important for the neurological function. And this is a big issue, for example, about B12, vitamin D, which are completely often, or also ferritin, which is completely often correlated to a non-diagnosed celiac. And there are psychological outcomes which are very strong, like nervosity, dysphoria, and everything like this. And this whole complexity is very important to look at it. For example, if we talk about clinic, if we talk about clinical patients which are stationary, so they are not screened by celiac, for example. And we don't know if it's just the outcome of a non-diagnosed celiac disease, for example. Yeah, sorry. That's right.
No, brilliant. Yes, so you have opened a lot of possibilities. I think I will need to invite you to another webinar soon to keep diving in. But you also, I like it that you make this distinction between the potential symptoms while you already diagnosed, but also everything that comes from not having been diagnosed early enough. And that reminds me also of the path, and probably, and you both can develop further, the path for transitioning from pediatric towards adult care. So we have, again, not many evidence, but probably you can help us. That is a stressing time for many, many reasons. And I would like you to develop a little bit further. How do you see in terms of the connections with mental health, the transition, and also the follow-up? If you can elaborate a little bit more, Ronya, on how that, we already know that in some countries, celiac patients are regularly followed up. In other countries, not at all. They are given on their own destiny. So please.
Can I add a point before we go to the transition? Because I think it's very important for the transition as well. Because one thing, I have it often in my, how do you say praxis, actually? I have no word. Where you meet in the therapy room.
Yeah.
How you call this room? I have no word for it.
I think it works well. I think
in the institute? I don't know.
Yes.
Okay, I have a lot of cases in my work where one big issue about the whole anxiety question and everything, and the anxiety patterns also, is the parent-children, how you say, combination. Because often parents from celiac children, which are not affected by themselves, they're just a carer, which Ricardo, you told us you have children with celiac disease. Often, if they get diagnosed, the children, by early age, parents are very worried. So they have a lot of worries, which are not properly, sometimes they're not very reflected. They're often overprotective because there is a lot of worry that my child can have a gluten accident or something. And what I observe in my practical work is this over perspective, this over caring from the parents is a big issue one time for the stress for the children, because often they just copy the stress from their parents. One part of the stress at home, which is the stress from the parents, which affects also stress at home, and for the transition, because the parents, which are completely overprotective, take everything or give takes everything from the children away. Like I order for you in the restaurant. I call the parents of the friends from you, that when you come over to eat, we have something gluten-free for you and everything. And then comes the transition, and the transition is the biggest developing period, is to find your own identity, autonomy, and everything. And now you have your overprotective parents, which are not interesting anymore. You just want to avoid them, and your biggest avoidance or possibility to get your autonomy, like development psychology, is that you go when that you eat gluten, that you just provoke, and you strengthen your boundaries, that you find your own existence and everything. And that's why transition is so difficult for this question about celiac. Sorry, Ricardo, I talk and talk and talk. Go on.
No, it's fascinating. Yeah. Okay. What it comes to my mind is the issue that we have about 4 time related variables that we are commenting. One is the age when you are diagnosed. It is completely different to be diagnosed when you are a teenager, an adolescent, when you are a kid, when you are an adult. The time to diagnosis, how long does it take, that diagnosis that you also mentioned? Your experience in the gluten-free diet, it's another important criteria. And sorry.
And your body image, very important other criteria.
Yeah, of course. And the age of the patient. No, when it's diagnosed, but the age that they have at that time. They are probably been diagnosed before. So those 4 time-related variables are really important, and they are going to determine the answer, the reaction of the celiac patient, of the celiac person. What we've been studying and researching right now at this moment is the effect of what we call in psychology the self-efficacy expectation, and the impact in adherence to the gluten-free diet and quality of life. What we are finding is that it's very important to develop a proper self-efficacy expectation related to celiac disease. Very, very, very important. Okay.
Talking about the parents.
Yeah.
No,
if you overprotect the kid, your children, they are not going to develop a proper self-efficacy expectation. We define self-efficacy about the confidence one has to develop a certain action to get some outcomes. In this case, to adhere, to stick to a gluten-free diet, to go healthy and deal with the disease.
Very,
I think, sorry. I think one important thing as well in the transition is also the factor that you're not focused anymore on the adults. So the adults are, you couldn't care less what the adults say. So in the transition, the peer effect or the peer orientation is much more. It's a much higher and bigger influence. So the point from being like the others and being part of the group is a big surviving a big point or a big criteria which gives you mental health in the youth phase. So the point is, if we do not work properly with the peer work, like the youth per youth communication, youth per youth support, community support over social media and everything, we miss a very big factor where we could motivate and care about youth as well. So that's a very important part for celiacs as well.
What I believe, sorry, is that transition is very important when you are just diagnosed, recently diagnosed, when you are an adolescent, 15, 16, and you got to make that pass from the pediatra to the adult gastroenterologist. That's very important. But if you have been diagnosed as a kid, as a child, and you have developed a proper sense of efficacy, and you have the knowledge and you have the confidence and the motivation, it's not that important, the transition. But it's something but anyway, we need protocols to study how to make the best way possible that transition from pediatrics to adult gastroenterologists. It's a must.
Actually, we have a big problem about from the transition from pediatrics to the adult thing is the transition for children or for youth which are diagnosed as children. Often we observe a big doubt of the diagnosis because they get diagnosed very early. Afterwards, when they are in the youth age, they are very actually also psychological. It's their they have to do it. It's their developing challenge. They have to be critic. So often we observe a lot of young people which are doubting the diagnosis because they never survived or they never had the experience. How is it without the symptoms? It could be, but there are also asymptomatic people and people which higher support of amount and blah blah blah. And the thing is, in Switzerland, they developed the gluten challenge. I think it's from Switzerland. I'm not very sure if it's somewhere. It's copied from somewhere else. But for example, it's a campaign exposition to gluten, which is managed with a gastroenterologist and a nutritionist, that young people can challenge their gluten exposition to actually, it's a very important thing, Ricardo, with the self-efficacy, also the self-awareness. How does my body react to gluten, and why is it meaningful to have the diet? And that's a big thing of I don't know if you all know the concept of Antonovsky, the sense of coherence. Actually, it's the main. The sense of coherence explains why are people committed to a therapy, and what helps them to be committed. And one part is the meaningfulness, the Verstehbarkeit. It's if they understand what happens, and the other thing is if they're the manageability, if they can do it. But the meaningfulness it's a very important part, because if you do not feel, you would never have the diet if you do not see the outcome.
So just a question to make sure that we all understood, Ronia, and that is an exercise that is happening, is made in place, is a protocol in Switzerland to allow
Protocol is a big
to allow adolescents to get reassured with the diet.
It's a method in the clinical area, which is it's not a protocol at all.
All right.
We have a big lack of protocols about celiac disease, but it's a trial and an exposition possibility.
Okay.
Sorry, Ricardo, we wanted to add something.
I believe that protocol, that challenge, gluten challenge, may be quite dangerous, psychological from a psychological point of view, because many patients are asymptomatic; they have no symptoms at all. Some of them need to go on a gluten diet for months before having bilious damage, gut damage. So if an adolescent goes into a gluten challenge and feels that he or she has no symptoms, well, that could be dangerous. That could make difficult the future adherence to the gluten-free diet.
That's a very interesting thing. The point is, from the psychological part, it could be dangerous. The question is always, what's the point? Because in the first time, we know that young people, they have to explore, they have to feel boundaries, they have to go like strengthen the thing. The thing is, the gluten challenge is not it's not a private thing. You don't do it like, I want to challenge, because the thing is, they do it anyway. If they have no symptoms, they do it anyway. They avoid gluten. They avoid the gluten diet. They eat gluten. We observe it very often that if we ask young people, they are not committed to they're not compliant anymore, because that's the biggest thing ever, that they hide it, but they are not compliant at all. So we lose them anyway. The thing is, you give them an option to control regularly, and give them also the permission to explore and respect their wish to be self-aware and to be to explore the situation. And the thing is, the asymptomatic people which have to eat gluten-free, which have celiac, they also show the how you say the values. You also find problems in the. So the thing is, they do not feel the symptoms, but you can show numbers. You see how they develop.
Not always. Sorry.
Yes, but then
20%
but then it's
or
the question.
20% of celiac people is seronegative.
That's
especially adults or going into adulthood. So we probably put them in a challenge, and we don't have any way to demonstrate that they are harming themselves between those boundaries of the challenge.
Yeah, but Ricardo, that's the big question. If you have no results, if you cannot show them numbers, and if they doubt the diet, you will lose them anyway. So that's actually
not
otherwise.
All of them, not all of
yeah,
them.
not all of
Not
them,
all
sure,
of them.
but they are not your clients then. They are not your clients which want to try the gluten challenge. The gluten challenge is not a regularly recommended situation. The gluten challenge is a solution or a trial to support young people which are doubting, also the people which are like they are doubting, that they are not
I want to move
compliant.
to the next question. I see that someone in the chat says that yes, she also thinks that the gluten challenge is very dangerous for a systematic, but I know that I think we need to organize another webinar to go deeper.
Yeah, it's because it's a very complex question.
Because it's a very complex issue. But I also want to play the devil's advocate here, because many of the things you are saying, which are fascinating and great, one could argue that apply to all people anyway. Like, it could apply to any adolescent that needs to go through that process of changing from being a kid to becoming an adult. Or you mentioned stress, anxiety, and I could say yes, but we all, with the type of lives we live, we are all in a great level of anxiety. So the question will be how a celiac patient can get the intelligence to to identify the alerts, the signs that are telling, this could be something that is because I'm celiac and I should ask for help. So I give first the floor to Ricardo and then to Ronya.
Okay. Going on a gluten-free diet is quite difficult. I would say the diagnosis is quite shocking, depending on that time-related variables we have spoken. But if you see after 1 year, you are still in an important social restriction, you are not participating in life with your friends, with your companions on a normal basis. If you have changes on the mood, you have an altered mood during this year or after this year. If you are still making voluntary or unavoided or voluntary or invisible transgressions, and you are putting at risk your gluten-free diet, you should consult, because in that year you have needed to have developed the knowledge, the confidence, and the motivation to stick to a gluten-free diet for lifelong strict gluten-free diet. If after 1 year you have not developed the competence, the confidence, and the motivation, all those three pillars, you should ask for help. Because, sorry, those elements are very important, because you can have high confidence if you lack competence. If you believe that going on a gluten-free diet is something easy, you can feel very confident, but you have you are being temerary. It's not temerary.
Yes.
Do you say temerary? You are taking too many risks. So it's not a problem of confidence, it's a problem of competence, knowing about celiac disease and gluten-free diet. And if you don't have the motivation, if you lack the motivation, you need to work the physical outcomes, the social outcomes, and the self-evaluative outcomes derived from going on a gluten-free diet. So if you are still making transgressions, voluntary and voluntary transgressions, you have altered mood, or you have some kind of social restriction and you don't participate as you wish, you should seek for help. Because as Ronia said, this is a trip to empowerment, to autonomy. First, the parents take the control about the diet of the celiac kid, the celiac children, but they need to empower them through adolescence towards the adult life, because you are not going to be forever there to help them with their gluten-free diet, and it's a gluten-free diet for life. And my piece of advice that I could give is that you have to start very strict You got the knowledge. In the case of kids, you got the children, you got the knowledge, so you got to be strict. And that going in a gluten-free diet needs to be seen by the children by like a kind of freedom, being each time more freedom, more free, sorry, more free, and develop new behaviors and conquer new places, going to new restaurants, going to new countries, going to uh, getting new behaviors. And I call it conquer. It's a conquering process. You got to conquer places and go with your celiac flag, put it right there, and say, "I'm here." And I was thinking, sorry for this long question. I was thinking yesterday that we are not patients. We are very patient. We are very patient. I mean, to be celiac requires a great deal of patience. So I don't want to call
and stubbornness.
Yeah, I don't want to call celiac people patient. It's a disease. I wouldn't say it's a condition, but I don't want to call them patient because they got to be very patient. I want to call them user, customers, clients. They have rights and they have to fight for them. We got to go beyond the salad, the chicken, and the fruit for desserts and try to eat something, some new things in new places. And
I think that will be the last sentence. Go salad.
Go beyond the salad. Yeah, correct.
Yeah, and Ricardo, that's a very nice conclusion, or a very nice thing, that we are a movement and we have to fight for our rights. Absolutely. I want to add something about the question, when do I have to seek for help? And you said a very good thing, like, aren't we all stressed, and aren't we all anxious, and are we all have, I don't know, things. I want to say, yes, sure. And if you need help, so just take your help and ask for help and talk to friends. However, if you're diagnosed with celiac or not. So that's my first thing. Yes, absolutely. It doesn't matter if you're celiac or not. But about celiac, I want to add something very important, which is, for me, very important. It's the nutrition behavior. Because one thing is that celiac, there's a big correlation between celiac and eating disorders. And so one part is what Ricardo already said about, if you see that your mood is going, that you are dysphoria, or you're over nervous, your nervous system is not coming down, your anxiety raises and everything, those are symptoms which shows you something is not in order. And if there is no explanation, you have to seek for help. Also, if you see that your stress level never goes down, you're under tension every time and we talk about food, or if you are in a food situation or something. But the other thing is also that if you are over, and that now comes the very, very stupid, or how you say, the paradox of it. Because if you're working with eating disorders, I work a lot with eating disordered people which are not celiac, the biggest and most important thing is to calm down from the over prospective, over cognitive overload about food. So you are just focused on food, what you eat next, what they read, all the Inhaltsstoffe, all the ingredients and everything.
Yeah.
Now comes the very paradox situation for celiac people, which could have already a prediction for eating disorder. For example, they struggle with weight before the diagnosis or something like this. So they're already, or they struggle with their body image. So you're already very focused on food, and now you get the diagnosis, and it gives you not just the permission, it gives you the you have to read every sorry for my question, fucking package, every ingredients list, and you have to be over focused on food by getting healthy. And now comes the big coincidence between one part, what makes you psychologically, you want to be relaxed with food, you want to feel yourself, blah blah blah, And the other thing, you have to focus on food. You have to be aware what it is. And now there comes a big paradox. And there is also a natural restriction who comes with the celiac disease, with celiac diet, that you have to be restrained eater. So like not the amount, but what you want to eat. So you have to how we say, keep your impulses. You have to restrict a lot because you want, for example, eat something in the bakery, you can't. So you have to take back your desires. The problem is, if you take back your desires or restrain yourself a lot, it makes the same pattern like restricted eaters, which can be over compulsive eating afterwards, where it breaks down the restriction. You restrict, and then you have a lack of energy, and then it makes like that. And that's why a lot of celiac disease, celiac people, there's a high amount of binge eating disorder as well, where you have your eating attacks afterwards, for example. And all those patterns, all those paradoxes, and all this overthinking about food are signs. Take help and shout for help, because it's really, really, you're not alone with it, and it's not rare. So it's very important. I like the idea of Ricardo about 1 year, after 1 year. And also I want to add 1 year, or if you have life crisis, or if you have life changes, it could be always also a trigger or a new situation for you, where you have to arrange your new situation, for example, after pregnancy or after thing, blah, 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 where you could have completely new problems with the celiac disease, and then seek for help.
You didn't mention it yet, but traveling is we will have in our conference.
Ricardo mentioned it about the flag, where you have to put the flag on.
It's a terrible. I can imagine, and in the previous webinar we discussed already about going for Erasmus to a completely different country with a completely different food culture, drinking culture, because maybe you go to Germany where everybody drinks beer and you cannot, and that changes completely your social life and connection and so on. But I see that there are already some questions on the chat, but I wouldn't like to stop before asking you, like, you mentioned a lot of things very, very important that are connected to your professional experience, really in clinical or otherwise. But I want.
Is it me or is it you, Veronica, about the thing?
Unfortunately, it's me. But I wanted to say it probably, or ask you to reflect on, probably there are other elements that could be improved through policy makers. So if you have to tell like one short 1 minute message to policymakers, either in your own countries or at the European level, what will that be? And I give the floor, I think it was Ricardo first and then Ronia.
Okay, what I think sometimes is that I watch my TV and I see on the news that they have adapted the breaking news to deaf people. They sign to sign language, sign language. Okay, and I take the elevator, I take the lift, and it's adapted to blind people. And I go to the streets, and they are adapted for handicapped people. And I sometimes think, what about my issue? I mean, why I cannot eat when I take a train to go to Madrid, or why I cannot eat when I go to I take a plane. I can have potato chips and peanuts. You know, that's what I can give to my family. So first thing, I think we need to legislate some issues and establish some protocols, but most important, or more important, is to enforce those protocols. I mean, you can have a gluten-free menu, some options in a bar, but how can we know that 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 menu is gluten free? I mean, you are probably talking to a competent waiter, but they have hired a person for the kitchen for 300 euros a month, 2 hours a week. And what do I know about the training of that people? So I think we need protocols, but more important than that is to enhance the law and reinforce the law and the protocols, and increase inspection in some cases. I think in many countries we probably the purchase of groceries, the food for home is quite well solved, but we got a problem with eating out and traveling. I think our research, we have, as we said, we have carried out a great extent of research on self-efficacy, on traveling, on eating out, and several other areas, and we found that the main problems are there. So we need the governments to make steps lower, smaller for us,
barrier to lower the barrier.
To make us easier to climb those stairs up. I think I see how some barriers are being eliminated for other people, and I'm asking, or I would ask them, what about my problem? I love those barriers to be solved for the rest of the people, but
No.
we don't have a medication and we have a treatment that is perfect, because gluten-free diet is perfect. It seems that they forget to help us a little sometimes.
Completely.
Excellent.
I agree completely, Ricardo, and I want to add something, because the big thing about movements is the power of people, which are a lot of people. And actually, this could be one very important thing, is to hide the diagnose and the diagnostic and the awareness of medical people, that because we are so many people, and if 75% of the people which are celiacs do not know that there are celiacs, that's a big lack of people which can support the movement to fight for our rights, and to also to raise awareness. And I think they're a big pain point. We have to diagnose it more. We have to find the cases which are not detected, because it's a big health issue, a big cost issue for the health system, because all the not diagnosed celiac diseased people, they have follow-up problems with their health, and it costs the system, and it's for them, all those people, very, very heavy. And there are a lot of reasons why we have to diagnose it more.
And finally, sorry, we need to promote association. We need to promote association to become a larger number, as Ronia said, and be more powerful. And many celiac people is not associated, and I'm associated, or my family is associated to the local association, but we are not associated for what the association can give us now. We are trained, we are competent, we are confident, we are motivated. We pay that money for those who are going to come in the next future. We are making that for the rest to come, as those who did it for us before, to benefit us. I know many things, or enough things at least, about celiac disease and gluten-free diet. My children don't need the association any longer, about that competence, about that confidence. We can travel, we can do many things, but we do it, and we still pay every year for those who come, because I think it's very important, the role of association for everybody, even for us.
That is an excellent message, Ricardo, and I wish many people thought like you. So the first question was, it's about fake news.
Very important social media thing.
Exactly, because as you know, and it's also related with what you just said, Ricardo, get associated, because the associations will provide you information that you can trust. But unfortunately, many people, and me included probably, will go to Google Doctor, say, hey, I feel this way, what is it?
Veronica, Google Doctor is not a problem. Big thing is social media, and we have to be aware how the impact of social media and some influencers is on the nutrition behavior of people and the health behavior. And it's a big thing. And we have a lot of fake news there as well. We have a lot of effects by communities which are pushing each other in anxiety and over awareness and stuff like this. And we have to fight against fake news, but that's a whole world, a global situation about going around fake news. And that's how we have to raise media competence. We have to raise science competence, also how to read studies, how to detect information, how to know where sources come from. And it's not a celiac situation. It's a global, worldwide situation about news.
Yeah, and what you said, not only the new being fake, but the dynamic, the social dynamic of raising anxiety, right? So yes, unfortunately, we cannot give a very simple solution because the problem is much bigger than for celiac disease only. There is also another question: how can we help children to face this problem? I don't know if Patricia is referring to the problem of social media.
No, I think about the diagnosis, about eating gluten-free.
It is not easy for them to eat everything when they are in a party with their friends and schoolmates. Do you have any piece of advice, Ricardo or Ronia?
Well,
Who is it?
I'm not sure if I'm speaking. I'm a psychologist, but my kid was diagnosed when he was 20 months old. So I had to face all that. And my daughter was diagnosed when she was 13. So I got the other case around. You know, uh, my piece of advice would be to be quite strict. Lovely strict, with lots of love, but strict, and to see and probably and slowly start to letting
Be autonomous.
being autonomous and in, sorry, eating more products and more foods, but starting being strict only with a natural gluten-free diet, no processed food, and after 6 months or 1 year, in natural products, start to introduce other products and see those products like somehow how to release that restriction, gluten-free products, processed product, gluten-free, but start some kind of strict and controlling the menu, but
Ricardo, can I
there's
now?
no
I'm a bit
exceptions.
critic.
No
I'm
exceptions.
so sorry, Ricardo, that I'm now comes the nutritional psychology part. I'm so sorry. I agree with you completely about helping them, also like having a release after. The thing is, I wouldn't recommend the restricted period, because it's about the connection to food, because often children, for example, 6 months for children is a very long period. And in my experience, it's very important to give them from the first second all the options they have, and no restricted phase, because the important thing is there are so many possibilities they can, and the most important most important part is they contain, or they keep up relaxed a relaxed behavior with food. And that's why I support being relaxed as possible at is as possible it is, as possible as, I don't know, so gut wie möglich. Genau, because my thing is how to support children. First, I want to say, give them a lot of space for their emotions, that they can talk, that they are not just, for example, one thing which is very difficult for children is the thing that they are always like special, but not in a positive way, and give them like the meaning you are more than just your disease. You have more aspects from your personality which is not the disease. And then also giving them space to survive, to go through negative emotions as well, like to be sad about it, to be angry about it, but also to be flexible about it, to take it easy, and just to give them and to hold the emotions and give them words to speak about the emotions. That's the psychological part, but also to support the children to deal with the disease by themselves, that they explore cooking, that they explore baking with their friends, and that they as soon as possible.
Sorry, I understood cocaine. Did you say cocaine?
Yeah, that's what we want to take as a short message. Explore the drugs. No. Cooking. Ricardo, cooking.
I also understood.
I understand cocaine.
Yeah.
Okay. No, the whole cooking, the whole baking, the whole
cooking.
Also,
cooking. Okay, cooking.
Yeah,
okay.
No cocaine.
Okay.
Also to explore the sensuality of food and everything, and also the competence to explore food and to adore food and Genuss, like what's the Genuss?
Tasting.
Not the taste. If you enjoy food, you're such, and that's why
we have 2 more minutes, and I don't see any other. I hope they get some inspiration from both your answers on how to help their children. And I think at the end of the day, they need to. Every children is different, every parent is different, but hoping that they get some inspiration from what you both have said to help them. And yeah, a last comment was here about the fact, and I asked you for a final note on that, the fact that celiac disease doesn't have a medicine, and the only medicine, our only treatment is gluten-free diet. It might not help to take the disease serious. I don't know if you want to make a final remark on that question. It's more a remark than a question. But yeah, the person says it's actually very frustrating for many celiac that is not taken serious because of that. I don't know if you have a final note, Ronia, and then Ricardo.
My final note is talk about your awareness, or how you erleben your life with celiac disease. And it's important to make sensibilization about it, to raise awareness for celiac, also the complexity. And I think actually I don't have it very often that the people are doubting the disease factor, but that it's important that we talk about our psychological situations to each other. It doesn't matter about what, and if it's heavy for you, it's heavy for you, and to have the respect to each other about their life issues. And I think to raise this awareness, it's also a thing about mental health and mental diseases. And it's also a discussion, if you can't see it, you are not affected. And that's the thing, we have to respect each other more for that, and raise awareness about also mental health. And that's the thing.
Fantastic. Ricardo?
Well, one of the problems we got because we don't have a medication for celiac people is that we don't have money from laboratories to finance research on celiac
Yes,
people, because
word.
it's not a big problem for them. So we are always short on money for investigation. But fortunately, we got a perfect treatment for celiac disease, which is a strict gluten-free diet. And in the case we develop a new medication in the next years for celiac disease, a pill, would you give it to your children? Would you have it? Or would you still stick to a gluten-free diet because it's a perfect treatment? I don't know. I don't know how to answer that. But I would like to end.
We'll leave it open, and we
Yeah.
organize another webinar on this.
Sorry, we would like to finish saying that thank God the 99% of researchers and scientists in the history of humankind is live right now and investigating and researching at this moment, So I believe that our children are celiac, but they are not going to die celiac. There's going to be some kind of solution in the future years, future 20, 30, 40, 50, but we are, I got the sense that we are reaching the end of this story. Okay.
Wonderful. So with that happy note, we welcome Ricardo Fueyo and Ronya Shifton. Is that all right?
Yeah, that's right. Yeah.
It was such a pleasure talking to you, discussing this very important topic. I hope it's not the last time, and that you come for another interview soon. And I wish the audience found it useful. And this will be published on YouTube, so people will be able to watch it as many times as they want. Thank you so much, and have a lovely day.
Thank you for participating.
Thank you, everyone.